There are many theories. However, no one has been able to talk about a causal mechanism. We know there's a strong association between hearing loss and dementia. So when you talk about hearing loss, there are two types. Hearing can be divided into two parts. One is a peripheral hearing loss that we have. Someone has a permanent hearing loss due to damage to the cochlear hair cells in the inner ear. So that leads to sensitivity problems. So they would need increased amplification, increased loudness so that they can hear better. So then we have something called central auditory processing. That means the ability to process the information at higher cortical levels. So that means you might have heard old adults saying things like, oh, I can hear people one to one, but if I go to a noisy room or in a group, I'm really struggling to hear what they're saying, or they say people start mumbling. What happens is understanding speech is a complex signal. So in order to understand speech, you need the information coming from both ears. The timing cues, the intensity cues need to be processed at. So we call it central auditory processing. So what happens is, as we age, the time it takes to process this information and these central auditory processing skills become a bit lower. And so what happens is, we know that peripheral hearing loss is associated with dementia. Now we are moving more towards understanding the association between central auditory processing and dementia. So work I have done in my team, we have seen that many years before formal clinical diagnosis, people who are at risk of dementia have shown very poor central auditory processing skills. So in addition, when someone has a hearing problem, that increases their risk of depression, anxiety and stress. And also they wouldn't want to pick up the phone and talk to someone or go to a group gathering. They tend to isolate themselves. And even if you are surrounded by a lot of loving and caring people, if you can't participate in a conversation or join the dinner table conversations, you feel emotionally lonely. So all these are risk factors for dementia. So together I think everything contributes, and that increases the risk of dementia.